Hello, this is Chris Frigno. This is going to be a 2 to 3 slide discussion on the dorsal expansion hood or the extensor hood. You can think of the extensor hood as a hood or as a cape. Here would be the apex of that cape. So let's say you were wearing a cape. This would be around your neck and the cape would flare outward this way and this way. And then the base of the cape would be in the approximate vicinity of the metacarpal phalangeal joint. So working proximally to distal, the extensor hood starts at the MCP joint and ends at the distal phalanx. And we'll see several structures contributing to make this hood. So here we see an extensor hood, and we can make out a metacarpal bone here, a proximal phalanx, a middle phalanx, and a distal phalanx. So that would be a metacarpal phalangeal joint in this area, a proximal interphalangeal joint, and a distal interphalangeal joint. And here we see this expansion hood or dorsal expansion hood or extensor hood. Note we have an extensor digitorum tendon that is going to come in and it's going to get connected in with this extensor hood. We're going to see that there is a central tendon that extends down to insert distally. Here we can see a dorsal interosseous, a palmar interosseous, and a lumbrical. We're going to talk about all of these. We can see that lumbrical with its proximal attachment onto the FDP tendon or the flexor digitorum profundus tendon. The lumbrical has lots of unique characteristics. Number one, it does attach to the FDP tendon. Number two, its distal attachment is on the extensor hood, so it has no direct attachments to bone. Here certainly would be an indirect attachment to bone, and here would be an indirect attachment because obviously the FDP ultimately is connected with bone up in the forearm. The third unique thing about the lumbrical, remember, is it has split innervation in that the first and second lumbricals, i.e. those that serve digits 2 and 3, are innervated by the median nerve, while the third and fourth lumbrical, i.e. those that serve digits 4 and 5, are innervated by the ulnar nerve. Then we get to the function of the lumbrical, and this is where it's very unique. Now recall, the lumbrical passes anterior to the metacarpal phalangeal joint. So if this right here is the axis of rotation, that would place this line here as the lever arm, allowing for the lumbrical to have a flexion moment, if you will, or a flexion torque at the MCP joint. So it's able to flex the MCP joint. But because of this attachment in the extensor hood, its effective tendon, in other words, now we're looking at this structure, courses posterior to the axis of rotation of the proximal interphalangeal joint and posterior to the axis of rotation of the distal interphalangeal joint. So we have a small lever arm here and an even smaller, but still effective moment arm here. So what does that mean? Again, the lumbrical performs flexion here and then extension at both the PIP and the DIP. Now we can move on up to the interosseous muscles. Now this is labeled a dorsal interosseous. This is unlabeled. This is probably another part of that dorsal interosseous, but we're just gonna pretend this is a palmar interosseous because this visually right now appears more palmar than this, but realize they're not in the same interosseous area, right? On some areas there's palmar interossei and on other areas there's dorsal interosseous, but let's assume this is a palmar interosseous muscle. That palmar interosseous muscle would extend its effective tendon down also into the extensor hood. It's going to be very close to the lateral portion or medial portion of the joint capsule or of the joint itself. So let's say this is the axis of rotation. It's going to be very close to that axis of rotation. Now, one would think that doesn't play a very effective role in frontal plane motion because it's so close. However, not a lot of torque is required for abduction and adduction. Now, this is a palmar interosseous, so that's a pad, so that's an adductor. So because it goes lateral or medial to the joint, depending on which digit we're talking about, it's going to be able to adduct. Now, it is extending up through here, so if it were to apply a torque on the PIP or DIP joints, it would be an extensor torque just like the lumbrical. However, the lumbrical is a more robust muscle, so it's going to be a much more effective extender here. That said, palmar and dorsal interosseous could also extend. Here we see the dorsal interosseous muscle again, similarly sending its tendon across to the side, and again, because it's on the opposite side than the palmar interosseous, it's going to do an opposite motion. So it's a dab, so it's going to be an abductor. Moving further dorsally, we see the extensor digitorum tendon. It's going to come down and contribute or attach in with this extensor hood before it essentially throws its tendon centrally down in this area. We'll get a better view of that in just a minute. Here we can see that extensor digitorum tendon coming down, getting connected in with the expansion hood or the extensor hood, and then throwing off its central tendon, and that's what it's called here, a central tendon, to insert onto the second phalanx. Because it's connected in with the extensor hood, and the extensor hood gives off these lateral tendons or lateral bands, which is what they're called, the extensor digitorum can indirectly attach to the distal phalanx as well. So as this tendon shortens, or as the muscle, which is attached to the tendon shortens, it's going to pull up on the extensor hood, which is going to pull up on these lateral bands to help to extend the distal interphalangeal joint, which is how the extensor digitorum tendon can control both the proximal interphalangeal joint and the distal interphalangeal joint. Here we can see the lumbrical muscle extending anterior to the axis of rotation for the metacarpal phalangeal joint, extending up, contributing to this extensor hood, and going posterior to the axis of rotation of the PIP and the DIP joints. This is a Frank Netter image, and this has always been nice for me to envision the line of pull. You can see the line of pull of the lumbricals and the long extensor tendon being in extension here. Here is the black representing the extensor digitorum tendon, and then the reds representing the interosseous and lumbrical muscles. So in summary, the muscles that contribute to the extensor hood are the extensor digitorum, specifically its tendon, the lumbrical, dorsal and palmar interossei muscles. What muscles do not contribute? These long flexor tendons do not contribute to the extensor hood. What is the purpose, or what is the benefit of having an extensor hood? Well, it gives us fine motor control. It allows us to extend our pips and our dips, as well as our MCPs, very smoothly, and it doesn't have to be an all or none extension phenomena. We sort of mentioned this when we talked about the lumbricals in general, where the lumbricals help with fine motor control. They allow you to flex at the MCP but extend at the DIP and transition in and out of that movement smoothly. Well, it's because of the extensor hood and this complex relationship. As always, thank you for listening, and please let me know if you have any questions.